section, I want to talk about what causes schizophrenia. There really isn't a simple answer to that because several factors play a part in the onset of the disorder. Research shows that the risk for schizophrenia comes from a combination of biological factors acting together with environmental factors. We call this the stress vulnerability model. In order for a person to develop schizophrenia, he or she must have some biological vulnerability for that disorder. Vulnerability means being susceptible or at risk. How vulnerable someone is will vary from person to person, depending on several factors, which we'll talk about in a minute. Stress has an impact on vulnerability and can either trigger the onset of schizophrenia or worsen its course. Let's take a look at this graph together. Amount of biological vulnerability is on the bottom, and amount of stress is on the left side. People on the bottom left are those who do not develop schizophrenia, and people on the top right are those who do develop schizophrenia. Looking at the left side of the graph, you can see that people who have no biological vulnerability to schizophrenia won't develop the disorder, even if they experience tremendous stress. The majority of people fall in this category. For those who do have a vulnerability, you can see that as vulnerability for the disorder increases, less stress is needed to bring about the disorder. Now let's talk about biological vulnerability. Biological vulnerability comes from both genetic and physiological factors. Let's talk about genetics first. A family history of schizophrenia does not necessarily mean children or other relatives will develop the disorder. However, studies have shown that schizophrenia does run in families and can affect multiple members within families. Take a look at the red line. The risk is highest for an identical twin of a person with schizophrenia. The identical twin has almost a 50% chance of developing the disorder. Let's look at the yellow lines next. These lines represent first-degree relatives, meaning these people share half their genes. The risk of developing schizophrenia is about 17% for people who have a fraternal twin with the illness, 13% for children who have a parent with the illness, and 9% for people who have a sibling with the illness. Let's look at the green lines next. These represent second-degree relatives such as aunts, uncles, and grandchildren. Here you can see that the second-degree relatives of someone with schizophrenia are also at greater risk for developing the disorder than the general population, which is represented by the purple line at the top. Now let's talk about physiological factors that can also increase vulnerability. Some of these risk factors include pregnancy and birth complications, such as greater paternal age, malnutrition when in the womb, exposure to a viral infection while in the womb, and low oxygen levels during birth. Biological vulnerability can also be increased with alcohol and drug abuse. Cannabis use, especially before age 15, has been identified as a big risk factor for schizophrenia. Thankfully, certain medications can reduce biological vulnerability, most likely by correcting the imbalance in brain chemicals called neurotransmitters. Neurotransmitters are brain chemicals that communicate information throughout the brain and the body. An imbalance of the neurotransmitters dopamine and glutamate has been linked to schizophrenia. While the exact role of these neurotransmitters in schizophrenia is unclear, we know that medications that affect these neurotransmitters can lessen symptoms and minimize the chances of relapse. We'll talk more about the medications for schizophrenia in part 7 of this series. Now let's move on to the stress part of the stress vulnerability model. As I said earlier, environmental stressors have an impact on vulnerability and can either trigger the onset of schizophrenia or increase symptoms. Examples of stressful life events include losing a parent early in life, death of a loved one, physical or sexual abuse, or loss of a job. Stressful life events don't necessarily have to be negative. Getting married or having a baby are examples of positive events that are also stressful and can trigger symptoms. Other stressors that are risk factors for schizophrenia include negative family relationships involving feelings of anger or hostility among family members, or frequent arguments between them. Lack of meaningful structure, for example, just sitting around the house all day, is also stressful and a significant risk factor for schizophrenia. That wraps up our discussion of the causes of schizophrenia. We touched on the main risk factors for the disorder, including biological and environmental risk factors. Join me next time as we talk about the onset and course of schizophrenia.